So there's a couple different ways that oral health and heart health are connected. The main way that oral health and heart health are connected is because of inflammation. So we know that if we have inflammation in our mouth, that's causing our gum tissue to actually break down and allowing the bacteria that are in the mouth that are causing harm to enter the bloodstream. And one of the first places they go is the heart. Now, the heart is super important for pumping blood and oxygen to the rest of our body. We need that in order to function. Well, what happens when we have oral inflammation that leads to systemic inflammation is it actually causes the inside of the blood vessels, especially the ones helping our heart function, to become sticky. They actually become more porous. And so what happens is plaque and fatty streaks start to accumulate along the inside of those blood vessels. And that's how we get an increase in the amount of plaque that starts to form inside the blood vessels and cause heart disease. So heart disease is kind of an all-encompassing term. Heart disease can deal with anything that affects how the heart functions. So this means it can affect how blood comes into the heart, how the electrical system of the heart functions, and also how well the heart can pump out oxygenated blood to the rest of the body. So some examples of this would be hypertension, coronary artery disease, myocardial infarction, which is actually the word for heart attack, congestive heart failure, which means that the body is not pumping out enough oxygenated blood that the body needs. And it can also mean talk about things like arrhythmia, which is where the electrical system of the heart doesn't function properly. A lot of people have heard of this as AFib, which is a very common condition. So the problem with heart disease is a lot of times this is silent. So people can be suffering from all sorts of these ailments and have no idea that anything is going on. But some things that people could be aware of is if they have super high blood pressure that is, uncontrolled, they could experience things like headache, a lot of pressure in the chest, dizziness. Arrhythmia can a lot of times feel like a heart flutter, or sometimes you can feel like your heart almost skips a beat. Or you can feel like sometimes your heart is beating really fast and then other times it's beating really slowly. Unfortunately, things like coronary artery disease, when we're starting to get plaques built up inside our vessels that can lead to heart attacks, oftentimes you don't feel those at all. So the only way to really know if you have those conditions is to go to your doctor and get blood work done. Not necessarily oral signs of heart disease, but what we know is that if someone has periodontal disease in the mouth or even dental abscesses or caries, that we know that that's negatively affecting the heart. So if someone comes in and their blood pressure is really high, which every time you go to the dentist, you should be getting your blood pressure checked. That's kind of a side tangent there. But if your blood pressure is high, and then we also notice that you have pretty severe gum inflammation, gum infection, or gum disease, and also some abscesses, you certainly want to go and make sure that your heart is okay. One of the signs of high blood pressure actually is if we are doing a deep cleaning on a patient, or if we do surgery and take out a tooth, those patients will bleed an excessive amount. So you'll actually see the blood like pumping out of the extraction socket. And that is, can turn into a medical emergency. So again, it's always important to have your blood pressure checked before a dental procedure. That way, if it is high, we can make sure that we are set up to manage it properly.